Thank you, Mr. President. Amendment 3018 is our chance to turn what we have heard to be a negative into a positive, to change a bill that is being forced upon public employees that almost certainly will result in drastic changes that upset individual lives, into one that actually tries to solve the problem before walking Iowa's public employees off a cliff. Let's be clear. There's no plan for the future of health insurance here. We're walking dedicated workers who serve our state and our local communities off a cliff. We'll tell you later, when you have no option but to simply accept your plan and deal with its consequences. That's what we're talking about if we don't adopt this amendment. Senator Schultz reminded us, this is local control for managers to dictate plans. But those managers who actually want to work with their employees to offer quality health insurance that meets the needs of their workforce, they have no local control to do that. Senator Shelgren, I believe you're right. There is a mandate here, but it's a hollow one. It's without any standard, any floor, or anything else that would provide any worker in public employment in this state with any sense of comfort or security about their ability to access reliable, quality health care after this immediate effective date bill gets passed. And there is a substantive change on health insurance in the bill, one that makes it an illegal topic for the employee representatives to talk about with their employer. Senator Schultz, you said that collective bargaining is a defined legal activity and then went on to imply that public employers can just talk to workers in the workplace about their insurance. I hope I've misunderstood you. I hope you are not engaging and encouraging public employers to go around the bargaining table to negotiate directly with employees, get outside their chosen representatives, and engage in intimidating negotiations that affect the terms and conditions of employment. I hope we are not implying that what used to be prohibited, unfair labor practices are going to be the new norm in the new era of collective bargaining, because that invites abuse in the process. That invites intimidation. There's a reason why workers in this state have chosen to bargain collectively, to have a union member that they chose negotiate the terms and conditions of their employment. Because collectively they're working for the best outcome for their collective group of employees. The real point of this legislation is that it excludes the voice of the workers that are affected by their benefits from the process of determining those benefits. What you're talking about of including and engaging workers is why we have, as a permissive topic of bargaining, health insurance. That's why we invite the discussion. That's the whole point, is to get the workers' input in the conversation, not dictate a plan to them. I think we're confused about what the bill actually does. And for that reason, we have an opportunity here to do something that says, wait a minute, we haven't thought this out. We don't really know what it means. We don't know what will happen in the aftermath of this legislation. So why don't we take this opportunity? Invite the people who actually are affected by this the most to sit down and talk about these issues and come through that process on the other side with a system we can believe in. Senator Chapman discussed all the great plans that are out there outside of collective bargaining agreements in our state. I can't wait to see how many zero-cost, low-deductible, high-benefit, open network plans start raining down after this legislation will take place. I think history is going to have an interesting way of telling that story. It's going to reveal what this legislation actually does and how it actually affects Iowans who serve our communities in public occupations. Let's be real about what this legislation does. Let's be grounded in our conversation about what is really happening here. The reality is, right now, negotiated union agreements set the standard for health insurance for employees across the state and in our communities that engage in public service. Senator Schultz, you also mentioned that there's no mandate here to change any plans. We can all just continue along on the other side of this cliff. Here's what we know about health insurance. There's no way to deny that health insurance costs, options, programs, carriers, and other factors change and have gone through rapid evolutions. But right now, we're freezing everything in time in terms of our conversations with employees affected by these plans. We have no way to work out changes with employees after we get to the other side of this legislation. I've heard conversations from the other side of the aisle about how benefits for public employees are so far out of line with those for private sector workers. You know who gets the right to talk with their employers about their benefits? Private sector workers. Private sector workers can form a union. Private sector workers can use that union to negotiate over health insurance. The legislation in front of us does nothing to bring up the quality of benefits for private sector employees in this state. Again, as we talked about yesterday, it only tears down and holds back. And it does it to those who answer the call of public service. I've heard from public employees. I've heard from public employees who have choked back tears as they think about what could happen to their loved ones who have critical needs for health insurance. They're fighting back tears because they don't know what's on the other side of this. But they do know they don't have a voice in what is on the other side of this. This has the very real potential of upsetting their lives. Senator Danielson is absolutely right. This isn't really about unions or state employers. It's about the individual lives that could be greatly disrupted because the benefits they count on will change without their influence. We've also heard this legislation doesn't eliminate health insurance, but it very well may make it that when we get to the other side of this, health insurance is so expensive that our public service can't make ends meet by being a part of it. Or it leaves so few benefits that it has no real access to quality care by being a part of it. We cannot demean the value of public service in this state by gutting employees' ability to work with their employers on something as critical to their daily lives as health insurance. Let's take this opportunity to do what is right by valuing the workers whose lives are actually affected by this legislation and give them an opportunity to have a voice in the process. I call upon the members of this Senate to adopt an amendment that embodies the very spirit of reason and compromise that brought about public sector bargaining in the first place. I move this amendment and ask for a record vote.
The senator from Polk moves the adoption of Senate Amendment